Well, is it a bit nippy at your house? We have snow here in Albuquerque. Of course, our pets wear coats. Do we need to worry about them? Well, I'll tell you, even big dogs with thick, healthy fur, even they need a decent outdoor shelter. These things, just being a big guy and having fur doesn't exempt anybody from hypothermia. So let's not wait for them to start shivering and for their lips to turn blue. Has anybody here had a problem like that? Or actually, the bigger questions I tend to get is from folks who are concerned about a neighbor dog. Oh, Cindy, you're here. Thank you so much for coming. Very often people want to tactfully help their neighbors and effectively improve the quality of life of the neighbor pets who people are, let's face it, they're neglecting them. Well, let's talk about some good ways of sharing information and some valuable information. And by the way, in case we haven't met, I'm veterinarian Dr. Jeff Nickel. This is the Nickel Family Border Collie, Miss America. And Carolyn will have a couple of cat feeder toys for me in just a minute here to induce these little characters, thank you, up onto my desk so everybody can see how well behaved you gentlemen are tonight, right? And how well you get along. Tony, here, this way, baby. And I have a little story about Tony at the end of this thing I think you guys will enjoy. Yes, Miss America. So, let's talk about this problem, shall we? Because there are some very serious medical issues that can become emergency situations and they can kill. Here's a paper that was presented at the Western Veterinary Conference a few years ago called Environmental Emergencies. It was written by a veterinary critical care specialist, and it covered the whole gamut about what's going on internally in the body when these things start to become a problem and how they're treated in the emergency facility. I'm not going to bore you with those details, but let me just share with you what starts to happen, a cascade of events in the body when these things start to go south. Predisposing factors to hypothermia, or low body temperature, include age, that's number one. Illness, if there's something else going on physically, and that is Isabella. Wonderful, thank you for coming. So age, illness, injuries, which really sap the body of strength and calories, by the way, because a lot of the body's energy stores go to dealing with the infection, and they're not available to help generate extra body heat when the temperature plummets. Electrolyte disorders and lack of acclimatization, easy for me to say. Acclimatization is if you have a pet who is outside, but they haven't had time to gradually acclimate for their coat to get nice and thick and for them to develop some really valuable dead air space between the longer guard hairs and the little fuzzy downy hairs that trap dead air space against the skin. And so if a pet has been indoors a lot or has just moved to a cold climate, they can get into serious trouble if they're not physically prepared. And that can happen sometimes, especially in New Mexico, for example. This fall, we had really warm days. I mean, this is climate change, right? And then all of a sudden it got really cold. So these pets weren't having a chance to get acclimatized or prepared physiologically. Thank you, Carolyn. Isabella, of course they are well behaved with you. No, thank you. I think you're looking the other way. These guys actually aren't very good friends, but they kind of tolerate each other. Anyway, Miss America seems to like them both. So, two initiating factors: exposure to cold temperatures, be it air or water or mud, and a predisposing factor which prevents the normal physiologic response. Conditions that increase susceptibility to cold environments include, here we go, number one again, age, what are called endocrinopathies. These are hormone imbalances, things like low thyroid hormone, more common than many people realize because it's not obvious in every case. Diabetes is another endocrine problem, and there are plenty of others involving the adrenal glands largely, but there are others. Malnutrition, and that doesn't necessarily mean that the dog is too skinny, but I can tell you what, if they don't have a healthy, appropriate amount of body fat, they can their internal core temperature can drop like a stone. But malnutrition actually means bad nutrition, not necessarily undernutrition. But yeah, poor quality food or not enough of it. Neurologic disease, trauma, some medications, and what's called sepsis, which if they're really, really sick with a raging infection, bacterial usually, they can succumb to low temperatures. So normally alterations in the core temperature, perceived by a little part of the brain called the hypothalamus, does many things. In this case, and probably its most important function, is regulating the internal core temperature, whether it's really hot outside or really cold, okay? Result in the constricting of blood vessels to shunt the blood to the core organs, the internal organs, which if we don't preserve their well-being, then we die. So shivering occurs when the body is saying, my goodness, we have to generate more heat somehow. And so the body starts moving quickly. That is put into motion by adrenaline and other what are called catecholamines. These are hormones, actually, which are released to speed things up and to shunt blood to the internal part of the body because we're trying to preserve life. So low body temperature, and we start seeing shivering, we're already going down the wrong path. And in fact, I make a joke about blue lips in pets. Obviously, we're not going to see that. But when that occurs in people, it's because the blood has been shunted to the internal, the core areas of the body, and external peripheral areas, like the lips, don't have the same kind of blood supply they normally do, and hence they look blue. This is telling us that there are pathologic changes occurring in the body in its attempt to survive. These are things to watch for. And shivering, of course, when it's really severe, the pet, you can see it from a distance, but very often you have to touch them to know that it's moving in that direction. So, as hypothermia progresses, metabolic compensation begins to fail and organ dysfunction occurs, which means that these pets can die of organ failure. So, the therapy for these things, the first thing you want to do is throw a blanket on them. You absolutely should. The animal should be insulated from further heat loss to the air and to the ground. So using blankets, cardboard under them, scooting them very gently, tarps to shelter them from the wind. The first thing you have to do is, before you say, how are we going to correct these internal problems that are going in the wrong direction in a hurry, we have to prevent further heat loss. And so cover them and protect them not only from heat loss to the air, but heat loss to the ground. And so move them very slowly, because when they start getting into real trouble, because of the adrenaline release and the other shunting of blood internally, if we are move too quickly with them, we can actually set into motion cardiac arrhythmias. These are abnormal heart rhythms that can be life-threatening. This is a big problem, right? So passive external warming, like heating pads, for example. I mean, this is just your garden variety heating pad that you plug into the wall outlet in case you have a sore back or you just want to warm the bed up a little bit before you crawl in. These things can be pretty handy, but when we use these on pets who aren't fully with it, or in a dog house or a cat house, they can spend too much time laying on one spot, and you get one area of the body or a few that get exposed to too much heat, and we can get thermal burns. These things back in the day used to be used on surgery tables in veterinary hospitals because the body temperature can drop due to anesthesia. Well, we started getting into some burn problems, and then they developed these hot water circulating blankets, which are so much healthier and more effective. So in veterinary hospitals, we don't use those and haven't for generations, and they really don't have any place in a pet's doghouse or cat house, or in a situation where a pet needs to be warmed up. As soon as you can wrap that pet in a blanket, it needs to get to an emergency veterinary facility where they can use moderately warm fluids, an ICU cage with warmth, other devices, a real cool thing called a bear hugger, that's BAER, which wraps around them, and there's a fan that blows warm air through it, and very gentle, very even around the surface. We use it in anesthesia a lot. There are a lot of good ways that a veterinary clinic can do it very slowly and very safely, well, along with other support, medical support. So, gosh, I mean, it's a big problem, isn't it? And so many pets are miserable during the night, and they don't quite go far enough, and they live to suffer another day. Holy smoke. Has anybody here had experience with that kind of thing? Send it to me on, put it in the comment line, and we'll talk a little bit about it. So, you know, I get questions on this sort of thing, and as you know, I have a weekly column in the Albuquerque Journal, and this is a very lengthy answer I gave to a question, which, frankly, has got everything in it. So let me go through it with you because I don't want to overlook anything that's important. Here's the question. I'm worried about my neighbor's pets because it's getting so cold at night. They have 2 cats and a dog who huddle up together in a pile each night in a corner of their yard. Well, you know, that little corner, maybe there's some old leaves there, maybe some branches and stuff, and they can be sheltered from the direct wind, and they can trap a little bit of their heat there, and they can share some of their heat. These pets are kind of desperate, aren't they? And the truth is, the dogs and cats can be pretty good friends, but it isn't really a natural behavior for them to have to huddle up between different species. These are stressed pets, and so this person was right to be concerned and write in for some information, for some ideas. I told the neighbors that I would ask your advice, that's me, and I know that they will do what you suggest. So I'm hoping people do. They are nice people, I just don't think they know any better. And you know, that's really at the essence of a lot of these problems. It's very easy to be judgmental, I get it. People like you and I, we love our pets, and we wouldn't think of even gambling with their well-being outside on a cold night. But other people, maybe they weren't raised the same way, and we can set an example of empathy for them and show them how it's done. And we'll talk a little bit more about how to share some choices, just some thoughts for you. So, okay, here's my answer. It's actually remarkable how well dogs and cats actually can survive in the elements. So many of them actually adapt and make it. As much as they could get through another winter on their own, they are sure to feel much better with a decent shelter. And the shelter is really about trapping heat. We'll talk a little bit later about how to allow them to take care of themselves in a good, snug little house. Considering how well they get along, this neighbor cats and dog, they may do very well with one house, like a pet house, to share. They can start with one, but once the pets feel more comfortable, they might start getting territorial, and somebody may get thrown back out in the cold. You know, that just may be their nature. So nobody should fret about that. It may just be necessary to get a second pet house for these guys. In that case, you may need one dog house and one cat house. Either way, the following are the fundamentals for a snug and healthy shelter. Let's start with the floor. It may be more important than the roof in some respects. That's because the cold ground literally sucks heat out of the body. And while a wooden floor is fine, it needs to be an inch or 2 above the ground. That clearance will not only prevent direct loss of body heat, but it will also provide the insulation of dead air space as if the sides of the house are built to come all the way to the ground, with the floor elevated a couple of inches. This way you can prevent the wind from blowing under the house. So the sides of the house all the way to the ground, but the floor built up a couple inches. You can buy dog houses like this. The walls, well, how high should they be? Determine this by standing the tallest pet and measuring his or her height at the shoulders. Multiply by about 1.5, and this should be the interior height. And use the same multiplier to determine the length of the house. That is, it should be about 1.5 times the length of the longest pet. Is that another question that I just got? Perhaps we could provide some guidelines for people who have not had so many pets. You're right, Isabella, and I'll tell you what I'm going to do. This, there we go. If they see a cat or dog shivering severely, a sort of basic instruction list on how to act immediately, a bit like what we have for humans who appear to be having a stroke. I know you have these in the USA as well, but perhaps you could publish a quick one-page on your Facebook page. Well, thank you for suggesting that, because I intend to put this paper that I'm just sort of skimming through and hitting the highlights I will put this on my Facebook page when we finish this Facebook Live. You can share it with anybody, and I think that it's going to be helpful. Okay? So, why not make the house even bigger than just 1.5 times the height at the shoulder, 1.5 times the length of the pets? Well, I thought you'd never ask. We're not trying to save on building materials here. Aside from keeping these critters dry and draft-free, the house has the essential function of trapping the warm air that is generated by their bodies. So once the air on the inside of the house has been warmed by the pets, it in turn will keep their little bodies warm and they will stay comfy. If the house is too big, they will keep putting out heat and they'll never fully warm the air. This wastes a lot of important calories. You know, calories, if we're trying to manage our weight, we try to reduce the calories we eat. Well, calories are mighty important if we're going to generate heat on a cold night. Okay, the roof. A nice pitched roof with shingles works fine. However, it is attached, be sure to caulk the joints where the roof meets the wall to prevent air from blowing through. Boy, that sucks heat in a real hurry. Last, they need a door. And this is important. If it's nothing more than an opening, windstorms will blow through and they will lose heat in a hurry. You can simply hang an old piece of denim or canvas there. Carpet scrap can work okay. But it needs to be almost to the ground, maybe off the ground just an inch or two. Yeah, they're going to lose a little bit of heat there, but don't forget the heat rises. And the pet needs to feel like they're in a real honest-to-goodness den. And that means that they need to be able to see out of there a little bit. Okay? So this way they'll have a den-like feel that will give them security. It accomplishes the same thing by designing a vestibule, and there's a great way of doing this. So if the door is offset on the front of the house, they can go through the door and down a short hallway and then another little door into the open area of the dog or cat house. And this way they go in, down, and back in, and this little vestibule that has offset doors, that prevents the wind from blowing through, and you don't need a flapper door on that kind of stuff. Anyway, you can also purchase a dog glue. Those are insulated. It's a pretty good product. There are other dog houses you can buy, and you can also purchase, they don't seem to come this way, but you can purchase a dog house door, and they're made of these vertical clear plastic strips which the dog or cat can push their way through, and then they flap and close and seal it beautifully. And I will put a link on my Facebook page for a product that you can get. They're like 15 to 20 bucks, and they're easy to attach to the front of a doghouse, and they can make an enormous difference. And again, you can go with a carpet scrap or a flap of denim if you want, but these things are cheap and they work great. So go to my Facebook page after we're done, and I will put that link in there. Okay? Locate the doghouse on the south side of your house. People forget that the north side, for example, essentially gets no sun because of the motion of the sun as it comes east to west, especially in the wintertime. It's lower here in the northern hemisphere. And so the north side of the house gets essentially nothing. And yeah, we're talking about nighttime, but it's still going to be warmer on the south side of your house because the house itself will have taken in some solar gain and will radiate some heat. So if the doghouse is right against the south side of the house, it's going to stay warmer for the pets. But be careful. People want to put heaters in there, and they want to put, like a heating pad. And, I've seen these burns, but you don't want that. But you do need to know just how comfortable is it in there. And, if you can get out of bed at 1 in the morning, and you really should, to make sure that things are okay, and you can go out there and you can reach in there. But, this is the pet, particularly a dog's private den, and a perfectly well-adjusted, behaviorally healthy dog can get startled and bite. And it's not really their fault. So what I suggest you do is put a room thermometer in there and check that. You can get thermometers that will record the overnight temperature, and you can find out just how cold it gets in there. It probably shouldn't be any colder than about 55 degrees. Not a lot colder than what you or I would want in our house. They need to be able to be comfortable. On the other hand, if it's too hot in there, you're going to find your pets sleeping outside because they're going to, holy smoke, it's too hot in there. So you can make adjustments. You can adjust the door. But external heating sources, I would not do it. You just want the house to be snug and not too big. Okay? Does that make sense? Here's the other thing about the whole thing with pets and the kind of kindness that folks like you and I share for our pets, and we would love it if everybody did the same, is what the heck are pets doing sleeping outside anyway, right? I mean, my pets stay inside. I bet yours do too. Well, people have their reasons. And again, they don't know any better. Just like this person who wrote me this question, they feel like, well, what if the dog house soils during the night? Or what if they wander around or the cat jumps up on the bed and wakes us up? Or what if they wreck stuff? Or people just sometimes feel like, well, they're animals. They belong outside. But you can share your feelings about empathy with people. You can explain how much better they feel and how much more not only comfortable, but just like us, that being cold is kind of miserable. And we can make a difference. A lot of us give gifts to our neighbors at Christmas time. We like to do that. If you have a neighbor who has like a big dog and they say, well, he's a big guy and got a thick coat, but if they're not paying close attention, that hair coat could be matted. And matted hair is not a very good insulator. We just gave this little girl here a mighty good grooming just the other day. And she feels better. And I think she should have done that sooner. I mean, she stays inside. She runs and plays outside during the day whenever she wants, but then she comes in for the night, of course, and so do these two boys. But she feels better. So, yeah, a well-groomed coat feels better, certainly looks better, and it's a lot more effective insulator. So if you've got neighbors whose pets are outside, you could give them a gift of a gift card to a good grooming shop, and they can get these pets groomed. And you can give them a gift card to a pet supply store and get a house. And you can throw in a little flapper door, and you can actually say, look how much better they feel, and isn't this great fun? And you can advance your relationship with your neighbors just by showing them what fun it can be to care for pets. If your neighbors say, yeah, I don't want to let him in because he's going to make a mess, or if maybe you've got the same concerns with your pets, I don't think it's a bad sin of pet parenting to have your pets stay outside at night if you have an excellent enclosure for them and their hair coat's in good shape and they're healthy. But here's another thing about healthy. It's a relative term, isn't it? When I do physical exams on pets, which is a very big part of my work, I'm residency trained in veterinary behavior medicine, and that's my practice now is behavior disorders. And these are neurochemical problems in the brain. I'm not talking training issues. I'm talking real serious behavior problems. But I've practiced general medicine for many, many years in my career, and I can tell you that there's hardly anything I haven't seen. But what I have seen a lot of is people who, I examine their pet and I say, this pet is normal for its age. And that matters, doesn't it? Because when pets get older, including cats, their joints can become painful and arthritic. And you might not notice, especially with cats, because, maybe they're not jumping up on the furniture as much as they used to. We have to pay attention to that. Or dogs who start getting up a little bit more stiffly after they've been resting. Well, we know that cold weather really makes uncomfortable joints a lot worse. So an older pet is one who really needs to be inside during the cold weather, or have a particularly snug doghouse. And as much as bigger dogs with their bigger mass are capable of generating a lot more heat and being at lower risk of hypothermia, getting way too cold, that's true, but bigger dogs, they carry more load on their joints and they age faster. And so their joints are more prone to become arthritic and painful as they age. And it's a bigger problem in the cold weather. And so your general veterinarian can help you with that. There are some excellent anti-inflammatory pain management for older dogs, very safe, custom fitted to the individual. But we've got to look at, okay, what's the environment like? And what else can we do to help that pet feel better? And so if that pet's been outside most of its life at night, it's okay to move them indoors at night as they get older. And if you have any questions or concerns about some of these behaviors that worry you, go to my website, Dr. Jeff Nickel, drjeff, Nichol, and I've loaded just thousands of articles in there from all my years in practice and writing my media blog for the Albuquerque Journal. It's all searchable. And so you can put in there what you want and you'll find the information you're looking for on some of these behavior problems and what we can do about them. So I don't think that people should have their pets outside because they're worried about behavior. I think that can be managed, including house soiling, dogs who leak urine. Some of them do that. About 20% of spayed female dogs leak urine in their sleep. This girl here has that issue, but there's a very safe medication, actually 2 of them, depending on the individual. Keep that problem under control. Modern medicine is pretty good, and we can keep pets inside and keep them comfortable and keep our house clean. You know, I think that's all right too. So I just want people to build a foundation of trust and choice and freedom for their pets. You know, if we try to get our needs, the leader's needs met, and don't pay any attention to what's in it for the pet and what their needs are, well, like people, they can get obstinate, right? Got to be a two-way street. And it's never too late in a relationship with a pet to build that relationship of trust so that they know that they're not going to be intimidated by us and that we're going to care for them. And boy, people get so much back out of the relationship when they know that there's something in it for them. I don't care whether it's pets or another person. And I think that you can give that gift of empathy for your neighbors. If they're not caring for their pet, start with thinking about, I bet they're doing the best they can with what they know. So let's be kind and let's be empathic and give that gift first. And then you can share some of these choices. You can take the article out of my out of the Facebook page. I'll put the link in there. It's actually in my my website, and I'll put the link, and you can print it out, and you can share it with people and help them out with it. So I hope you can find some value in this thing, and I appreciate people putting in their questions, and Isabella, your thoughts as well. And I want to share one little brief story about Tony, my cat here. This little guy's 14. We got him when he was just a baby. He was about 8 weeks old. Picked him out of the litter. And, you know, he's gotten pretty used to living with us after all this time. And he has gradually become attention-seeking. People think of dogs pestering and nudging their person for attention, insisting on getting pets and that sort of stuff. Well, cats are known for attention-seeking too. And what he's learned to do, and it became a problem when he developed benign tumors of his thyroid glands. And we talked about that, well, probably a couple months ago, and managed that. We have a veterinarian who is licensed here in Albuquerque with radioactive iodine therapy. It's what's called nuclear medicine. And we eliminated the excessive thyroid tissue. He's so much better now. But he developed a growing appetite. Older cats with these benign thyroid tumors, it's called hyperthyroidism. And he developed this growing appetite. Well, knowing that I was managing this thing until his thyroids were actually ready for that nuclear medicine treatment, it's a process. You know, you just don't go in for the treatment. They got to be just at the right stage, not too early and not too far advanced either. And so, of course, he had a growing appetite, and so I'm shoveling food into him, you know, whenever he wanted it. So he's gotten to the point now, well, hey, all I got to do is complain. And so he's belly aching for food a lot, and so you feed him. And, of course, he's fine now. His thyroids are great, but now he's got this behavioral habit, right? And he goes, you know, I can get attention from my people. All I got to do is come and complain and stand up against you at your desk and pester you, jump up on you and start kneading your leg with his feet and walking around in front of the computer screen. And it's like, oh, brother, I'm trying to get some work done, right? So he's doing all this and complaining, and so you give him food now that he's fine. And literally, he takes a few bites, and okay, I'm done now. And also, it can be like 10 to 15 minutes, and he's complaining again. Well, you know, what are you supposed to do? Well, you can put him out, all that. And I thought, you know what? I was attending a online webinar, continuing education. Thank you for that heart, by the way. One of my colleagues in the Veterinary Behavior College, Dr. Chris Pockel, and he was explaining about some of these behaviors, which, of course, I've done my residency as well. But, you know, there's so much to be learned. And, you know, he's reading all the research he can get his hands on, and all of us do in this specialty. But he's sharing things I might not have found. And of course, there's always a few nuggets I can pick up from my colleagues in the specialty. And he was talking about a response substitution for these attention-seeking cats. And you require them to earn the privilege of being fed. Well, we've been doing this kind of thing with dogs for years. And I thought, I'm going to start that with my own cat. And so we taught this cat to come when called when he was a much younger kitty. So he loves this dry food, as we can, every time we start one of these Facebook Lives, I've got these little indoor hunting feeders, that Carolyn puts the food and hands them to me, and the cats, beat this out of these little pretend mice. So what I've done is I've taken just a few of these. He loves the texture of this dry food. Put the can of food, because we have him on canned food, so he gets lots of moisture. This is important for cats. And I squat down next to the bowl, and I tell him to sit. Give him a little push on the rear end. As soon as his rear end starts to go down, I drop the food in the bowl. And then sometimes I bring it up over his head as I tell him. And as he begins to sit, we capture the behavior by saying, Tony, sit. Well, he's starting to catch on. Of course, when I say, Tony, sit, I turn around, and this little border collie is, boom, her rear end's on the floor behind me, because she knows that something good happens when she does what she's told. So what Tony is doing is learning that there's a routine now, and that he has to earn the privilege of that food by sitting when he's told to. Jama, oh, good. Let me get to your question in only a second. Thanks for tuning in. So anyway, what this guy's doing now is the routine has been changed. He knows that he's going to have to work for the food. And so he's now going to where the food is and waiting there. So I go there and I do my part. I set him up for success by giving him a few little dry kibbles that he earns, and then he gets the canned food, and I close the door, and he's in the utility room by himself eating. He's not getting robbed by his little fuzzy brother here. And of course, Miss America, the scavenger, being just like any healthy dog, the next food she sees could be the last. So, I'm having fun with this little guy, and I'm also diminishing his attention seeking. So we're getting a few things accomplished. So, all right. So, Jama, you were here. Let me find the... sometimes I have a hard time bringing these darn things up. Shucks.
Sweep left or...
Sweep left?
Yeah. At the bottom, just kind of do a sweeping motion to the left.
It's not happening. There it is right there. Thank you. Okay. So I have a 14-year-old lab who has become grumpy with her siblings. She likes to snap and growl at them when they walk by her. She's had a recent checkup. Other than some arthritis, she's doing well. Anything you can suggest to make her less upset with her siblings? That is a wonderful question. Let me tell you something about that aggression. That's what we call anticipatory pain-related aggression. Here's what happens. Is that this older dog, she's 14, she's a big dog. You must have taken really good care of her to get her to be that age. And yeah, her joints are a problem. I don't need to examine her or watch her gait or see her x-rays, because any big dog that age has advancing degenerative joint changes. And I'm so glad you had your veterinarian examine her, and I hope you got her on some good treatments to help her feel better. It's quality of life, right? It's not just quantity of life. So these other pets, and you may never have seen it happen, but they're younger and they're more active, and they might have tried to solicit or demand play from her, or maybe they've been playing and they've crashed into her, and she's like, ow, and they bump into her and she moves quickly to try to avoid it, and ow, that hurts when that happens. Yes, that's right, little cute girl. And so what she now knows from repetition, and this is classically conditioned behavior, is that when they come near, it might be another ow. And so she's anticipating the potential for getting bumped into and getting the stab of pain. And what she's doing by growling at them is she's saying, buzz off, get back, don't come near me, I don't want this. And that's really kind of too bad, because not that you're going to have dog fights at your house, but if you have a less than stable other pet who might react to that growling and maybe a little lunging and snapping from your older dog, they can start mixing it up, and boy, I hate it when I have to deal with those things. Those are tough problems. And so you want that dog to feel better, but sometimes you can put up a little barrier. If she's got a real nice comfy pad You can get some really good quality pads for older dogs now. Keep her joints off the direct floor and give her a good medication to control the pain and inflammation. But sometimes what I've done is set up like a baby gate. And it takes a little management because, you've got your older dog on one side of it and the others on the other side. But they can enjoy each other's company, and the older dog can learn that they're not going to plow into me. But when she's up and moving around and she's been walking a bit and her joints start to loosen up a little bit, then she can interact with the other pets and maintain her relationship with them. So protect her from that kind of collision or that potential collision, because the problem that she has is the anticipation of the pain. That's the issue. Now, I had another comment here, I think, from Isabella. Darn it all, I'm having a hard time getting this thing to work, as usual. Okay, wait a minute, it might come back now. All right, here's what I'm going to do. Let me tap on the iPhone and see if it comes up here. There it is. Okay. Isabel, Dr. Jeff, as always, we agree with you many things. What do you think about CBD and those green lip muscle capsules for joints with older dogs and cats? We found them to be very effective and virtually no side effects. I'm glad you brought that up too. The green lip muscle, mussels like the crustacean, they live in a shell like a clam. And other sources of glucosamine and chondroitin and MSM. These are natural therapies that have what we call a chondroprotective benefit. Chondro always refers to cartilage, and the cartilage joint surface that in a young pet should be nice and slick and shiny and just smooth and nicely lubricated by that slippery joint fluid that allows our joints to work pain-free when we're young, right? Those things help protect the joint surfaces. They are not medications. They don't have a direct anti-inflammatory or pain-relieving benefit, but they do reduce inflammation because they have an antioxidant effect, and they reduce these little microscopic projections on the joint surface. These are called free oxygen radicals, and it reduces those so the joint surfaces are smoother and they lubricate better. There's some controversy about the value of them. There is some research that shows that it was no better than placebo. Other research that shows that yes, it did have benefits. I'm a believer in it. Miss America has been on a substance like that called Duralactin. It's a chewable, soft, moist thing we give her once a day. It's a microlactin. It's actually made from cow's milk. So there's a lot of different sources for these things. I think they're valuable. But if you have a serious pain problem, like that 14-year-old lab with anticipatory pain-related aggression, I would do those things, and I would use an additional medication like carprofen. That's the generic name of Rimadyl. There are other brands of the same thing, and there are other similar medications, and we have other things. Miss America here, her liver enzymes are a little bit elevated. We've been watching them. I've had her liver ultrasounded by a colleague in internal medicine. Nothing major going on, but I am not gambling with her liver, so I'm not using Rimadyl with her. Instead, we're using gabapentin and amantadine as pain relievers, and then occasionally, on a one-off basis, I'll give her a Rimadyl. It's not going to cause her liver any trouble as long as it's not a daily thing. So, we custom fit these to the individual. CBD in people, they have shown that among multiple different benefits it can have pain relieving effects. So can marijuana, of course, which is related to CBD. We don't yet have a really decent, robust research study on CBD in dogs or cats. So we don't know how to dose it. We don't know what side effects there may be. We don't know if in the dog's body it would conflict with other medications. And just because there are a lot of things that are becoming known about it in humans, although not near enough yet, we cannot assume that the same would apply to a different species. That's why there are two kinds of medical schools, We veterinarians know about other species, and we don't make a lot of assumptions about what goes on, although, of course, there are many medications that you can use on cats and dogs and people. but they behave differently in different species. So as an ethical, evidence-based practitioner, I do not recommend CBD in pets because I don't have the evidence to support it. We don't know what products are better, more purified, more potent. So I'm not going there. But I know a lot of pet parents who do and who have not had trouble. But from the evidence I have seen, the anecdotal evidence so far, CBD is not a real potent treatment for painful joints. But I don't try to twist my clients' arms and, shake my finger, don't you dare use that stuff. I just explain that we don't know enough about it to recommend it. And so we do have a lot of treatments that we recognize and that we do have the value in those. And I had another comment. So let me see if I can get this darn iPad to cooperate. There we go. Okay, thank you again. Wonderful. You're very welcome, Isabella. Is there anybody else here who has any questions? I really appreciate these questions and comments. I think that's it. If anybody else has a question, please put it in my Facebook page, and I'll address it there. If it looks like it might be valuable to a whole lot of folks, it might be useful for my weekly newspaper column, which, by the way, you can get that without subscribing to the Albuquerque Journal. You just go to my website, drjeffnicol.com, drjeff.nicol.com, and go to the bottom of the homepage, and you can subscribe. It's no charge. And every Tuesday morning, you'll get my weekly media blog, we call it, which is my column from the previous Friday in the Albuquerque Journal. And you'll get this Facebook Live from the previous week. So you don't have to tune in. You can get it by subscribing. And when you do subscribe, I'll send you also, at no charge, my at-home pet first aid and CPR guide, which bullet points. This is what to look for to recognize the problem. This is what to do right now at home. And this is what you do on your way to the veterinary clinic. And this is what they're going to do for starters. So bullet points, and it's worth printing out and keeping it handy because, you got to act fast and you got to recognize what's going on and do the right thing. Sort of like treating hypothermia or a cold pet by getting them off the direct ground and wrapping them up and then getting them to the emergency clinic. So, thank you for sharing this time with me. Each week I write a media blog and do a Facebook Live because I'm wanting to bring out the best in pets and their people, including your neighbors who may not understand what the right thing for their pets are on cold winter nights. So, thanks for being part of this thing. I wouldn't do this if it were just me and my pets. So my cats are on the floor. They ran out of food on the table, so they're not there. But Miss America, say good night to our friends. And thank you for being part of this. And I'll see you next Thursday at 6 o'clock Mountain Time. Please be safe and wear your mask. Thanks.